Oral cavity lesions, squamous cell carcinoma. The most common type of cancer in India is the carcinoma of oral cavity. And among the carcinomas of oral cavity, majority are squamous cell carcinomas. And among the malignant tumors, oral cavity cancer is the most common malignant tumor in India. So, regarding the etiology of squamous cell carcinoma, it can be based on the etiology could be based on risk factors, oncogenic virus infection, and inheritance. So, the squamous cell carcinoma of oral cavity is a multifactorial disease which is usually seen in middle-aged men. So, the main risk factors are tobacco products and smoking, followed by alcohol consumption and some other minor risk factors. So, regarding the tobacco products and smoking, all the tobacco products contain nicotine, which causes cancer. The carcinogens in tobacco can act as both initiators as well as promoters. The tobacco may be used either for smoking, they can be used either as smoking tobacco or smokeless tobacco. Smoking tobacco means it may be in the form of cigarette, BD, cigar, or pipe smoking, or reverse smoking. Reverse smoking means the burning end of the cigar is kept inside the mouth. That is called as reverse smoking. And regular marijuana use causes oropharyngeal cancer. So, smoking tobaccos are cigarette, BD, cigar, pipe smoking, reverse smoking, marijuana. These are the smoking tobaccos. Smokeless tobaccos are in the form of betel quid. The main smokeless tobacco is betel quid or pan. So, betel quid or pan contains betel leaf, and this betel leaf in turn contains areca nuts, slaked lime, and tobacco. And betel quid is the major carcinogen, and sometimes slaked lime and areca nut are also act as carcinogens. So the main method of smokeless tobacco is betel quid or pan. The other smokeless tobaccos are snuff dipping and tobacco chewing. So the oral cancers are found on the sites where the tobacco products are held for a longer period of time. So oral cancers are mostly found on the buccal and gingival surfaces because these are the sites which directly come in contact with the tobacco products since they are held there for a longer time. So this is all about the tobacco products and smoking. And regarding alcohol consumption, the alcohol consumption acts synergistically with tobacco, either as a co-carcinogen by increasing the risk or as a promoter by decreasing the lag time. And the risk of squamous cell carcinoma of oral cavity is very high in individuals who smoke as well as consume alcohol. So the other risk factors include radiation exposure, welding, asbestos exposure, poor nutrition, vitamin A deficiency, immunosuppression, chronic irritation of mucosa which may be due to ill-fitting dentures, chronic infections or jagged teeth. So this is all about the risk factors which can cause squamous cell carcinoma of oral cavity. And regarding the oncogenic HPV infection, the role of oncogenic HPV infection. HPV is human papilloma virus infection. So, high risk HPV types are HPV 16 and HPV 18. The low risk HPV types are HPV 6 and HPV 11. So, these are the HPV high risk and low risk types which are capable of causing squamous cell carcinoma. So, high risk HPV 16, 18. Low risk are HPV 6 and 11. Inherited genomic stability means the family history of head and neck cancer, which is a major risk factor for squamous cell carcinoma. And regarding the pathogenesis of squamous cell carcinoma, it is a multi-step process which involves activation of oncogenes followed by inactivation of tumor suppressor genes in a clonal population of the cells. So first P16 gene is inactivated. In 80% of the cases, first step is P16 gene inactivation. So after inactivation of P16 gene, the stratified squamous epithelium undergoes hyperplasia or hyperkeratosis. Hyperplasia means gross enlargement of the organ as a result of cell proliferation, and hyperkeratosis means thickening of the keratin layer of the skin. Keratin layer is the outermost layer of skin, and if that keratin layer is thickened, it causes hyperkeratosis. So this is what happens in inactivation of P16 gene. And the tumor suppressor gene P53, if it is mutated, if the P53 gene undergoes mutation, it causes progression of hyperplasia or hyperkeratosis to dysplasia. The hyperplasia and hyperkeratosis progresses to dysplasia on mutation of P53 tumor suppressor gene. So what is dysplasia? Dysplasia is the abnormal development of cells within the tissues or organs which leads to cancer at a later stage. Amplification and overexpression of cyclin D1 gene, which ultimately activates cell cycle progression. And regarding the spread of squamous cell carcinoma, the local there are three types of spread mainly: local spread, lymph node spread, and blood spread. Local spread involves the primary site. It mainly depends on the primary site. Local spread depends on the primary site. Lymph node spread also depends on the location of primary tumor. If the tumor is more anterior, more will be the chances of spread to the cervical nodes. So more anterior the tumor, more is the spread to the cervical nodes. Example, carcinomas which are in the base of tongue and oropharynx metastasize to deep retropharyngeal lymph nodes. And regarding the blood spread, through the blood it can spread to lungs, liver, and bones. And regarding the morphology of squamous cell carcinoma, the major site of squamous cell carcinoma may be anywhere in the oral cavity, but the commonest sites are the lower lip, ventral surface of tongue, floor of the mouth, buccal mucosa, soft palate, and gingiva. The gross morphology of squamous cell carcinoma includes gross early stage and gross later stage. So in gross morphology, in the early stage it appears as a raised firm plaque or irregular roughened areas of mucosal thickening, and it may also be superimposed on a leukoplakia or erythroplasia at an early stage. Later, it may appear as ulcerated, protruding gray-white masses with irregular and indurated borders. And regarding the microscopy of squamous cell carcinoma, they range from well-differentiated keratinizing neoplasms to poorly differentiated anaplastic tumors. So this picture shows microscopic appearance of well-differentiated squamous cell carcinoma with hematoxylin eosin stain. And this is the diagrammatic representation of squamous cell carcinoma. This is also a well-differentiated squamous cell carcinoma.